Hi everybody, my name is Brent, and this is
Ava.
We're here to do a commercial for you about a common childhood problem with it's a pediatric orthopedic disorder called the Salter-Harris fracture. You know what that is? Alright, you think we should tell everybody about it? Alright, so Ava here, she's 5. It's not very common for her age group to have this problem, but in about 3 years she'll fall into the age group where she'll have to potentially worry about this because her bones are still growing, and so she has little growth plates called the physis, the epiphysis, and the metaphysis. In that little area, sometimes whenever kids are messing around and getting hurt and everything, they'll get a fracture in there, but it won't show up on an x-ray or radiography, conventional type of radiography. One thing that's important to start out with is to show the different types of Salter-Harris fractures. So if you'll come in a little bit closer, I'll show you what the normal physis looks like right here. This is the physis, the growth plate. In a type 1 fracture, only the physis is affected. It's through the physis, and this happens in about 5% of Salter-Harris fractures. In a type 2 Salter-Harris fracture, which makes up accounts for about 75% of all Salter-Harris fractures, you've got the physis and the metaphysis that are affected. In a type 3, which account for 10%, you've got the physis and the epiphysis, which are affected. And then in type 4, you've got the physis, metaphysis, and the metaphysis, the physis, and the epiphysis, which are all affected. And then in your type 5, which is very uncommon, it's from a crush injury, you've got the physis, which is affected. Some important things to note with these types of injuries. Some of the subjective findings that you might see from your child or from your patient, depending on who you are, is they'll have, of course, acute pain at their fracture site. Additionally, there might be some localized swelling and tenderness, so there could be some inflammation and erythema, as well as arthralgia, to use some medical terminology. And there may be obvious deformity that you can see, such as, some subluxation or something along those lines. And then there's going to be a history of trauma that's going to be probably reported by either the child, a witness, or the parent. Again, if you're in front of a healthcare provider. Some of your objective findings upon checking them out is you'll see that there's pain that's localized over that growth plate. So say we're dealing with the distal end of the tibia, maybe your lateral malleolus or your medial malleolus, or one of your metatarsals, or something in that region. Along one of those ends of any of those bones, where that physis is, that's where you'll be able to localize the pain to you during either your subjective or your objective. Subjective by having them point with one finger to where it hurts the most, or objective where you're actually going around and checking for crepitus and grimace and other such medical terminology type things. So something that will assist in determining and remembering which type is which is an acronym called SALTER, S-A-L-T-R. So a slip of the physis is one to remember the type 1. Above the physis would be type 2, which is, of course, again, that's the metaphysis. Excuse me. Type 3 is lower than physis, which means we're talking about the epiphysis. And then through the epiphysis, or through the physis, excuse me, that's the type 4. And then RAM would be for your crush injuries. So a little mnemonic that you can use there. At any rate, things that we can do to take care of this. I know you want me to hurry up, but I I've got some certain number of medical terminologies that I have to use, medical terms.
It's going to stop recording soon.
Okay. Alright, so we can rest, ice, compress, elevate, and then we can use closed reduction with a cast. We can do ORAF, which is the open reduction with internal fixation. Things we have to worry about with these types of injuries, specifically type 3 and type 4, as well as the type 5, are premature growth plate arrest, as well as angulation deformity. These are things that are going to cause issues later on in life for potentially the duration of their life. Failure to recognize the fracture and its potential for growth arrest and failure to maintain anatomic reduction are the most common causes of a poor outcome for the patient.